Welcome to Physio 101. Today I'll be talking to you guys about stretches and exercises you can do to prevent knee injuries and rehabilitate them as well. First off, I'm going to be explaining and demonstrating different ways and techniques you can do these stretches. Depending on where you are in your rehabilitation stage, these stretches will vary depending on your comfort zone. Standing on your left leg, bend your right knee and grab your foot with your right hand. Without leaning forward, flex your right knee and gently pull your leg back until you feel a stretch in your quad. If you have a hard time keeping your balance, use a wall or a chair for support. Hold for 4 to 5 deep breaths or 20 to 30 seconds. Do 2 sets with each leg. Next up is seated hamstring stretch, which targets your hamstrings. In a seated position, extend your right leg straight in front of you and pull your left leg towards your groin. Look straight ahead and slowly lean forward until you feel a stretch in your right hamstring. Don't arch your back to get more of a stretch. Keep your chest out and your back straight to avoid stress on your lower back. Hold for 4 to 5 deep breaths or 20 to 30 seconds. Do 2 sets with each leg. Next up is lying hamstring stretch. It targets your hamstrings and gastrocnemius. Lie on the floor and grab the back of your right thigh. Keeping your right leg straight, raise it as high as you can without bending your right knee until you feel a stretch in your hamstring or calf. Hold for 4 to 5 deep breaths or 20 to 30 seconds. Do 2 sets with each leg. Trainer's tip. If you're having trouble hanging on to your leg while keeping your back flat, wrap a towel around your thigh or the ball of your foot for leverage. If you can't keep your raised leg straight, try bending it the opposite knee. Next up is the iliotibial band stretch. Targets your iliotibial band. Stand with your right side facing a wall. Hold the wall with your right hand for support. Keeping your right knee straight, cross your left leg over the right and slowly lean to your left. Gently move your right hip toward the wall until you feel a stretch on the outside of your right hip. Hold for 4 to 5 deep breaths or 20 to 30 seconds. Do 2 sets for each side. Floss legs targets buttocks, hamstrings, abdominals, and core. Stand with your legs shoulder width apart and position a ball between your knees. With your back straight and your hands on your hips, slowly slide down the wall until your knees bend to about 80 to 90 degrees. Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then return to starting position. Do 2 sets of 10 reps. One foot balance targets foot, ankle, hip, and core. Stand with your legs shoulder width apart and look straight ahead at a fixed spot. With your arms on your hips, balance on your left leg for 30 seconds. Do 3 to 4 reps on each leg. Trainer's tip. If you have an injury, practice balancing on your non-injured leg. Extend your arms out to your sides at shoulder level if you're having trouble keeping for balance for 30 seconds. Next up are the leg exercises that help strengthen and rehabilitate your knees.